From the Sunflower Shoppe, this is the Healthy Approach Podcast. I'm Bryan Bradford. If I asked you about your pelvic floor, would you know what that was? If so, have you ever wondered if your pelvic floor is weak or strong? What are the symptoms of a weak pelvic floor? And can you make it strong again? Should men be concerned as well? Do we even have a pelvic floor? I have so many questions about this area of the body, and here to straighten me out is a board-certified orthopedic clinical specialist and doctorate of physical therapy, Jennifer McCauley from Aspire Physical Therapy and Wellness in Southlake. Welcome to the show, Jennifer.
Thanks for having me, Bryan. I'm excited to be here today.
So Jennifer, tell me, what is pelvic floor therapy and why am I only hearing about this right now?
So pelvic floor therapy is a branch of physical therapy that deals with all conditions related to the pelvic floor. And what the pelvic floor is the muscles that are at the base of our spine. So these muscles help for making sure our organs don't fall out. They help for sexual function, and they actually help for urinary function too as well.
So what are some symptoms of pelvic floor weakness? If someone's coming into your office to see you and what symptoms would you be looking for to know that their pelvic floor is weak?
So there are a lot of conditions that can happen in this area. So oftentimes, common ones we see, at least initially, are people coming in with urinary leakage. So I see a lot of postpartum moms after they've had babies, they complain about having to squeeze their legs because they're leaking urine when they cough or sneeze, or they can't jump on the trampoline. That's probably the most common thing we see. That's called stress urinary incontinence. However, this can actually progress to something called urge incontinence, which is when people can't make it to the restroom in time. It's something we see as people they'll say, oh, I'm driving home, and then all of a sudden I pull into my garage, and as soon as I go into my garage, put my key in, everything falls out. We also deal with issues that relate to the bowel as well. So people who have had chronic constipation and pelvic pain. So we treat people who have pain with intercourse, who also have conditions known as PCOS, endometriosis, and interstitial cystitis. These are chronic pelvic pain conditions.
So all those type of issues can call a weakness of our pelvic floor?
So they're not always weakness. So here's the interesting thing about the pelvic floor. If you don't mind, I'm going to show you a model of a pelvic floor here.
Please.
So the model I'm going to show you is a female model. So this is a model, this is like a pelvic bowl here of the model of the female pelvis. So if I were sitting here, so in the back, we would have the tailbone. In the front, we have the pubic bone. And when we're talking about pelvic floor, we're talking about the muscles at the base of the pelvis here and at the base of the pelvis here. So these muscles aren't always weak. And here's the thing about it is women will have leakage, and somebody will tell them, well, just go and do your Kegels. The problem with doing your Kegels is oftentimes the muscles are actually too tight. So I like to compare it to my arm. Imagine my arm is in a contracted state like this, and somebody says, you've got to strengthen it, and you're squeezing, and nothing is happening. Oftentimes what the muscles actually have to do is they have to learn to relax first so that you can actually use the muscles to function the way that they're supposed to. Now, these muscles down in the pelvic floor can have issues, just like you get knots in your muscles up here and you need something to release them and it allows something else to work better. The muscles down in the pelvic floor can have knots and issues too as well. So what we do in pelvic floor therapy is we do an assessment on these muscles. We figure out who's working too much, who's not working enough, and then we teach those muscles to engage in the way that's proper. And when we do that, all of these conditions that happen in the pelvis actually start to normalize.
Very interesting. So it's not always, like you said, a weakness issue. It can just be too tight. So, I mean, what kind of factors in our life would make that happen? Is it just all stress and being tense all the time, or dehydration? What other things?
That's a whole big thing that we can go into. But definitely, so one thing I want to say is it's not always too tight. Sometimes it's a coordination issue too. So, and what I mean by that is our pelvic floor doesn't work in isolation. None of our muscles in our body work in isolation. And one of the muscles that it works with is it works in conjunction with our diaphragm muscle. So we have a diaphragm that sits like this. We call this the respiratory diaphragm in our body. It's our muscle of respiration. We have our pelvic diaphragm, and they sit parallel to each other. When we breathe properly, the diaphragm needs to learn to relax and drop down so we get air. Yes, so we do that belly breathing. Well, the pelvic floor actually learns to relax as well. When we exhale, the diaphragm recoils and pelvic floor lifts. So there's this coordination and this symphony that takes place between these two muscles. Oftentimes, though, when we're stressed, we get into our fight or flight response. We start breathing from the chest. Well, the pelvic floor doesn't get this natural up and down motion. So the muscles start to become tight. Then we deal with sitting cross-legged. We're taught as women, got to sit those legs cross-legged, right? Don't always keep things, be a lady, sit cross-legged. Well, what happens is our inner thighs become tight, and those inner thighs tighten up the pelvic floor as well. So then when we go to use these muscles have been in a contracted state like this. So they are weak, but it's not because they're weak, like we need to strengthen them. We actually need to learn to make them relax so that they can move for us and work for us in the ways that we need them to in life.
So when a client comes in to see you, what should they expect? What are you doing to teach them this connection of breathing exercises and whatever other exercises that you're giving to them to help strengthen or relaxing pelvic floor?
I think the first thing that what we want to do is kind of let patients know what to expect when you come in. So I'll first talk about coming in to see me as a female client, but one thing I do want you to know is we actually treat men too as well, and we'll go into that just in a second. Okay. So for women, when women come in to see me, different than when you go to your OB and you get they check you internally, they're checking for your uterus. We get a pelvic exam. What we do in pelvic floor therapy is we're actually looking at the muscles down there. There are about 12 different muscles down in your pelvic floor, and we're checking for strength, tone, coordination, power, and endurance. So we're looking at who's working and who's not. We also look at your abdominals, your breathing, your hip muscles. We also look at just kind of making sure everything is working in harmony together and look at even your behavioral habits. So we put all of that together and really devise a program and figure out what needs to be worked on in order and how it relates back to your symptoms.
That makes so much sense. It really does. So basically, do you think nutrition plays a big part in this too as well?
Nutrition definitely has a role. So there are some conditions, chronic pelvic pain conditions. You may have heard of them. PCOS, endometriosis, interstitial cystitis. These are chronic inflammatory conditions. Some of them, the IC is basically the bladder is inflamed and it's causing a lot of urgency, a lot of pain in the bladder. It's also called painful bladder syndrome. And they have actually found that a lot of ways to treat IC is through the IC diet. So an IC diet is basically removing a lot of the bladder irritants. And bladder irritants are irritants that make the bladder spasm. They also increase our urgency. So citrus does this, chocolate, spicy foods, coffees, teas, carbonated beverages. So there's a lot of different things like this that play a role into healing some of these conditions. The other ones, it's the same sort of thing. They kind of look at more hormonal balance. So again, things that you would do to normally keep healthy. No processed processed carbohydrates. Eating lots of fiber, gluten-free, all of these things that we
right?
Yes, and good smart protein, eliminating the red meats. So things like that. So kind of how we should be eating anyway actually helps support the health of the pelvic floor, particularly with these painful bladder or painful pelvic pain conditions.
Well, Jennifer, since I can't get pregnant or I can't have cysts on my ovaries, do I have a pelvic floor as well?
Yes, you do. So men definitely have a pelvic floor. Their anatomy is a little bit different than ours, but actually they have all the same muscles. It's just, of course, they have a penis versus a vagina, but they still have all the same muscles. And men can have issues in these muscles just as well. So I think it's really important for men to realize, because women, I always say, are underserved. This condition is underserved, but it's particularly underserved in men. Men are sometimes embarrassed to admit that they have testicular pain or urinary leakage, or something just doesn't feel right down there. And they feel like they have to, there can be a lot of shame around it, and it's really something just as simple as like we have other muscles that need to be released. So I
Sure.
always encourage men to come in. We do free consults in our office to come talk to us and just talk about this and just know that all of these things can actually be addressed, and sometimes it's not as scary as you think it to be. I also
That's
see
right.
a lot of men after they've had prostate surgery. So when they've had a prostatectomy, oftentimes what they do in a prostatectomy is they actually, when they remove the prostate, there is these muscles called smooth muscles. These muscles basically help with continence. And
Mhm.
so those muscles get removed. So the things men don't usually have to think about it to maintain incontinence, but after a while, when those muscles are released, they have to actually retrain the muscles just like women do after they have babies to maintain their continence. But again, clinical studies have shown that if men get therapy a little beforehand to learn what to do, and then afterwards, their outcomes and maintaining continence throughout their life is so much greatly improved. So,
Yeah,
um,
I
you know
I found
somebody
it
or you have,
amazing.
yeah,
I'm sorry, go ahead.
it's really, I was saying it's really, I mean, it, the men who get therapy in this way have such better outcomes than men who don't have therapy in this way.
That's right. That's why I found it very fascinating what this pelvic floor therapy can do for men, especially because I saw it was linked to even ED issues, which means that
Yes,
not all ED is related to low testosterone. So it opens up a
it
whole
is
new
not.
world for men to look at other issues besides just a hormone problem. So I found that very
It
fascinating. Of course,
is.
prostatitis and what other conditions do you see associated with men having pelvic floor issues? You got prostatitis,
I think
ED.
the ED, I mean, those two are that and the urinary leakage are really the big ones.
Okay.
But the ED is, it's trying to get those muscles to actually strengthen again. There have been studies
Yeah.
that if you do pelvic floor therapy, especially with sensors and electrical stimulation, that you can get those muscles to turn on and they have higher outcomes. And they're able to
Yeah.
improve it. So yes, there's a testosterone component, but you'd be amazed to see what can happen with therapy in conjunction.
Well, I
So,
think
but
more
I
men
would
need
say
to hear this.
I I say men are so underserved. I actually see a lot of kind of middle-aged men that they have actually had pain from old sports injuries, old football injuries where they got hit in the abdomen, or baseball injuries where they've fallen, and it's caused a lot of tightness in their abdomen, which actually makes their pelvic floor really tight. Men who can't have an orgasm without having pain or things like
That's right.
that. So this is all very manageable, but we have to teach you all the tools to do it. So I always tell people, please do not suffer in silence. This is something that can be dealt with, and we provide a nice, safe environment for you to explore and manage all of this.
That's right. I just think that's more men definitely need to hear this because it's you're right, our egos get in the way sometimes, and but I think most of us are sort of trained mentally or through the medical side that it's mostly testosterone issues or inflammation problems, but I've never heard it referred to as a muscular issue in many ways, and the pelvic floor is really
Yeah,
what you're talking about.
yes, exactly. No, I had a man I helped with recently who his issues didn't start till he fell off a horse. And
Wow.
after he had an accident and he fractured his pubic bone, and everything changed. And let's say he had very good results, and he was very, very happy. And we did it in under 5 visits. So he was much encouraged with that. So it's
Very interesting.
a
So,
lot.
are there some are there some quick tips or anything you can give to for someone to sort of know if they have a weak or a tight pelvic floor just on their own, or do they have to come see someone like you?
So things I always like to make sure, if you want to know if you have a weaker tight pelvic floor, is can you actually perform the Kegel contraction? The Kegel is what we call pelvic floor contraction. It was named after Arthur Kegel, who was the one who developed it. Is and making sure, can you actually feel that contraction? Do you actually know what it is to dissociate that? And when you do it, can you actually keep your abdomen still, keep your glutes still? People try to do it and then they tuck their pelvis or their glutes contract or their inner thighs. So a lot of times they're used substituting because they can't find the right muscles. The other thing is can you breathe all the way into your pelvis? If you cannot breathe, like take a deep breath and breathe all the way down. Remember, I told you that diaphragm and the pelvic floor have to lengthen. If not, there's something tight in the pelvis that's restricting you. So I like to use the image of an elevator. So everybody always thinks about using that elevator to lift the pelvic floor up, but the pelvic floor has to go to the basement. It
Hmm.
has to know how to drop downward. Why? Bowel movements. You're not squeezing up when you're having a bowel movement. You need to be able to empty out. When you cough and sneeze, the pelvic floor needs to know how to lengthen and control against that lengthening so that you don't leak in the process. So it's big things is checking your breathing. Can you do it properly? And if not, and you're having any of these other issues, it's probably something that needs to be addressed.
Well, it just goes to show you how important breathing really is too as well. Proper breathing, not just breathing, but proper breathing is a big impact.
Yes. Proper breathing is everything. A lot of how our core stabilizes is through what we call this regulation of intra-abdominal pressure. We want the core to be functioning and diaphragmatically breathing. It's great for our nervous system. Diaphragmatic breathing is a parasympathetic response. So oftentimes we have injury, we have trauma, something happens in our lives and we get into the fight or flight and we end up like this. And when we end up in this chest breathing, not only does our pelvic floor not work, but actually it increases our incidence of low back pain, neck pain, shoulder pain. If I'm in this position, my shoulders are not in a most optimal position to reach them when I relax. So proper breathing is the foundation for all healthy movement.
That's right. And one other thing I love about what you're doing, Jennifer, is that you're looking at the body as a whole again. And that's, it's sort of unseen in the medical side. We've separated our bodily systems in the medical community, but now we have practitioners like yourself who are looking at the body as whole, as how everything's connected. So I love that about you and what you're offering there too as well.
Well, thank you. I think we need to see this more in the medical community and kind of put together these dots. And I try to see look at everything together, but I also try to put together patients' old injuries. Sometimes we realize things go back to childhood, things go back to old, like I said, the high school injuries that we hurt ourselves, and that's really kind of the etiology. And then when we put it back together, all these old patterns start to unwind. So
That's
allow the
right.
body a chance to heal.
And I want to go back to something I heard you mention. Are you saying that constipation possibly could be linked to pelvic floor issues as well too?
Oh my gosh, very much so, very much so.
Really?
So
Very
we
interesting.
have one of our pelvic floor muscles is called the puborectalis, and it literally lassos the rectum. So oftentimes constipation is because this muscle is actually too tight and it won't let things empty. So yes, we need to have proper fiber, we need to have proper water, but we definitely need to learn how to relax into that pelvic floor, to manually stretch it if we need to, and then so that everything can empty the way. Constipation is something we manage all the time here, and it's actually a much more manageable than people realize.
That's right. Well, and do people need a doctor's referral or anything to come see you since you're a physical therapy place, or can they just walk in?
So yeah, so in Texas, we have something called we have limited direct access here in the state of Texas, which means you can come in and see me. We can do our first session together. We can see each other up to about 10 days worth of visits. However, we are going to need to get something on record that says that has clearance for physical therapy. Unfortunately, that's the laws in the state of Texas. However, particularly in this field, I really like to already have a physician on a record so that we can do this together. But it could be a physician, but it can also be a chiropractor, nurse
Yeah.
practitioner, midwife. So it could be anybody at this point in time to help us. So
That is awesome, Jennifer. I think this is such a fascinating topic because it really I love how the body's connected, and especially in the muscular side of things, that when you get things
mhm.
working the proper way, how many things get corrected just by doing that? Even though I'm in the nutritional field, I know not everything is nutrition related. Some of it is just what you're doing. It's helping people to retrain muscles the right way, and I think that's just fascinating.
Well, so much of our pelvic floor is actually connected to both, it attaches to our sacrum and our coccyx and into our hip muscles. So oftentimes, if you have unresolving hip pain, low back pain, actually it could be a pelvic floor issue too as well. So I want you to know not all pelvic floor dysfunction presents as the scenarios that I'm talking about today. It could also be these unresolved issues that really you're working all these different trigger points, trying to get a muscle to getting something to relax, and it's just not quite resolving. Sometimes the trigger point is actually in the pelvic floor. And if you get that to relax, everything else feels better. So it's underdiagnosed and it's not looked at enough. And as both an orthopedic specialist and a pelvic floor specialist, I'm able to address those and weave those together seamlessly in my assessments and treatments.
That's amazing. Well, I heard about you through some clients that have come to see me and told me about what you're doing and how it changed their lives. And we even have a staff member seeing you and you're changing her life too as well. So that's why I wanted to bring you on the show today, so people can be exposed to this information, that there are other ways out there, or other ways to help move the body forward into proper health. And Jennifer, thank you so much for being here today. I really appreciate it.
You're very welcome. I really appreciate you having me today, Bryan. Thank you so much.
That's going to do it for this episode of the Healthy Approach Podcast. Please subscribe if you like this podcast and help us spread the word by rating and sharing with your friends and family. If you'd like to learn more about pelvic floor therapy, check out Jennifer's website at inspireptandwellness.com. And for all your nutrition needs related to pelvic floor health, go to sunflowershoppe.com. That's shop with 2 P's and an E, or visit us at one of our 3 locations in the Dallas-Fort Worth area.